Let's study osteoid osteoma. This is the commonest true benign tumor of the bone. This is the bone forming tumor and this is the true benign tumor of the bone. Pathologically, it consists of a nidus which has a growing center of tangled arrays of partially mineralized osteoid trabeculae which is surrounded by the dense sclerotic bone. On the clinical features, it occurs in the young adults of 10 to 25 years. It most commonly occurs in the male with the ratio of male is to female is 2 is to 1. It most commonly occurs in the long bones of tibia, which is the tibia is the commonest, and femur. It occurs in the diaphysis of the long bones. On symptoms, there is nagging, which is the continuous unrelenting pain, which is worst at night and dramatically decreases after giving aspirin and SAID so much that this is called the therapeutic test. On signs, we can see the mild tenderness at the site of the lesion, and if the osteoma is superficial, then there is palpable swelling. On investigation, we do the X-ray and CT scan. On X-ray, we see the typical radiolucent nidus 1 cm diameter, which is surrounded by the zone of dense sclerotic bone tumor. And CT scan gives the confirmed diagnosis. This is the X-ray of the osteoid osteoma in the tibia. Here we can see the nidus, which is surrounded by the dense sclerotic bone. Dense sclerotic bone. So in X-ray we see this nidus, which is surrounded by the zone of dense sclerotic bone. The treatment of osteoid osteoma is only effective treatment is complete removal or destruction of the nidus, complete excision of the nidus along with the sclerotic bone, or destroy by CT localized radiofrequency ablation. Prognosis is good. So the osteoid osteoma is the commonest true benign tumor of the bone. It is the bone forming tumor. Pathologically, it has nidus, which is surrounded by the dense sclerotic bone. It most commonly occurs in the young adults 10 to 25 years and most commonly in the males 2 is to, with the ratio of 2 is to 1. It occurs in the long bones of the tibia and the femur, the diaphysis of the tibia and the femur. On symptoms, there is pain which is worse at night and it dramatically decreases after aspirin and SAID so that it is called the therapeutic test. On sign, there is mild tenderness and if the osteoid osteoma is superficial, then there is palpable swelling. For the investigation in X-ray, we see this radiolucent nidus which is surrounded by the dense sclerotic bone and CT scan confirms the diagnosis. For the treatment, we completely remove or destruct the nidus, complete excision of the nidus along with sclerotic bone, destroy by CT localized radiofrequency ablation. Prognosis is good. This is the X-ray of the osteoid osteoma of the tibia. In the tibia, here we can see this nidus which is surrounded by the dense sclerotic bone. This is all about the osteoid osteoma. You can find these notes on the Telegram and the links are given in the description. Thank you.